In this section, we're looking at laws and regulations about governing health and safety. Our goal is to have the students be able to explain the laws and regulations, teach them to their future classes, and apply them appropriately. Now, it's important that the healthcare providers report the health issues that the Center for Disease Control's expects. And that way we can find out if there are epidemics and if there are big issues that need to be addressed. Sometimes certain communities have a infection going on that's not in other communities, and services need to be provided, and the CDC can help out with that. There's different kinds of reporting that needs to happen. There's mandatory written reporting, and this is for things like gonorrhea and salmonella. There's the mandatory reporting by telephone. That's where the provider must make a report by phone, such as for measles or whooping cough, and a total number of cases. And this would be in things like chickenpox and influenza. And then cancer, and these cancer cases are reported to the state cancer registry. So there's different ways these are reported, and it kind of depends on what kind of disease it is, and so on. Information gained from the reporting allows county and state to make informed decisions and laws. And this could be things like animal control, food handling, immunization programs, insect control, STI tracking, and water purification. So it's good that people should know that the healthcare providers are reporting this, but of course they don't provide the name of the individuals. It's unless it's certain circumstances, but it's more about the counting the numbers. Immunization is important. I don't think it's necessary to memorize this, but I think the information on the screen could be used as a resource. State laws establish vaccination requirements for school children. Laws often do not apply to children attending public schools, but they do not only apply to the public school children, but also those attending private schools and daycare facilities. And states may also require immunization for healthcare workers and the patients and the residents of the healthcare facilities. All right, so you can see that there are different things that need to happen at different ages for the child. And here's for the older children beyond 6 years. Again, you don't have to memorize this, but if you want it for a resource, you can see what is needed. So you can spend some more time on the screen and pause it if you want. And this is for the adults here. Now, all 50 states have legislation requiring the vaccines for students, although exemptions vary from state to state. All school immunization laws have exemptions for children for medical reasons, so if a student shouldn't medically get that immunization, they wouldn't be required to. Almost all states grant religious exemptions for people who have religious beliefs against immunizations, and currently 18 states have philosophical exemptions from those who object to the immunizations because of the personal, moral, or other beliefs. And again, you wouldn't have to memorize state by state. It's just good to know how the philosophies are leading in the United States. Infection control practices reduce the transmission of infection from one person to another, such as a healthcare worker to a patient or vice versa. What we're trying to do is prevent the spread of the disease through everyday habits. And now in healthcare and public health settings, infection control has various measures that prevent and contain the spread of infection disease. This includes hand washing, infection control standard, contact, droplet, and airborne protections, procedures for decontamination of persons and disinfection of equipment and environment, quarantine of contacts, if necessary of course, prophylaxis of exposed individuals, and control of the vectors in the infection. Last, we're looking at the consumer safety. The consumer rights and consumer protection laws provide a way for students to fight back against abusive business practices. These laws are designed to hold the businesses accountable and to see when they try to take advantage of consumers' lack of information or bargaining power. So we're trying to make it so that things are more fair and to avoid fraud. These laws exist at both the state and national level and are enforced by government agencies, the Attorney General, and often class action lawsuits filed by victims. The most common kinds of abuse business practices occur when there are vulnerable circumstances, such as debt collectors who are in a position to make life even more difficult by calling early morning, late night, calling to place of business, speaking to friends and family. The consumer right laws prohibit this type of activity. Also, predatory lending is an issue. There's forms the basis of a large number of consumer protection lawsuits. There's a broad range of issues here, such as the interest rates on credit cards, loans, handling fees, penalty, fine print. The foreclosure crisis of 2010 exposed numerous lending scams in the real estate market, and the federal legislation aimed at the predatory lending, specifically through the Truth in Lending Act and the Home Ownership and Equal Protection Act of 1994 were addressed. Now, consumer rights and laws also protect the public from false or misleading advertising. For example, if a business is trying to sell furniture and they advertise a very cheap price on the furniture, and then when the people go to buy the furniture, the sale price is no longer available, but it wasn't made clear in the advertisement. The dealer then pressures the shoppers into buying other furniture, which they will make more money off of. It's called bait and switch advertising, and the consumer laws address things like this away from, try to avoid this and have laws to protect the people buying the products from these things. So I think I went over a lot of information, although sort of quickly. We're looking at the disease reporting, immunizations, infection disease control, and consumer safety. Might not be a bad idea to go and spend a little bit more time with some of the slides just for your own information on when you're supposed to be getting the immunizations. That won't be specifically asked on the test, but is really good information to know.